But we also need to prepare for big issues that are already in full swing. We've talked about climate change and demographic transition, but antimicrobial resistance and access to antibiotics is one of them, absolutely. And so it affects literally everyone. And we have a fantastic panel here, which hopefully will also come up with very down-to-earth, practical suggestions to get the action against antimicrobial resistance, but also for sustainable access to effective antibiotics, as the title was of the special issue of the Lancet, because we need to look at both sides. It's clear we're not on track of what came out of the 2016 UN General Assembly high-level meeting. I hope that the one that will happen in September will be taken more seriously and that there will be full implementation, because we cannot really waste any full time. And without any further introduction, let me ask my good friend, brother, Dr. Tedros, to inspire and guide us. Thank you.
Thank you. Thank you, Peter. Thank you for joining us, Peter. We really appreciate it. Last year, he joined us as honoree because he was a WHO's Lifetime Achievement Awardee for his leadership over how many years? Long.
Decades.
Decades. And now thank you for joining us to moderate this very important panel. So really appreciate it. Dr. Abdullah Al-Guizani, CEO of the Public Health Authority of the Kingdom of Saudi Arabia. Dr. Yang Mi Ji, Commissioner of the Korea Disaster Control and Prevention Agency. Dr. John Kaseya, Director General of the Africa CDC. Professor Dame Sally Davis, the Dame part is UK Special Envoy on AMR. Professor Ramanan Laximinarayan, President of One Health Trust. Vanessa Carter, Chair of the WHO Task Force of AMR Survivors. Dr. Audrey Wong, Chairman of the Quadripartite Working Group on Youth Engagement for AMR. Excellencies, dear colleagues and friends, I would like to thank Her Excellency Prime Minister Mia Mottley for her outstanding advocacy and leadership as chair of the Global Leaders Group on AMR. We will hear from her shortly through a video message. Antimicrobial resistance is a growing and urgent crisis and is already a leading cause of death globally. In 2019, 1.3 million deaths resulted directly from bacterial AMR, more than 2 every minute on average. AMR threatens to unwind a century of medical progress and also threatens animal health, global food production, food security, and the environment. The United Nations high-level meeting in September is an important opportunity for global leaders to make measurable commitments towards stopping AMR. This is followed by the Ministerial Conference on AMR in the Kingdom of Saudi Arabia in November, where those commitments can be translated into concrete action. Yesterday, the World Health Assembly approved as a resolution on how to accelerate national and global responses to AMR based on a One Health approach. WHO is committed to supporting countries to implement the resolution together with our partners, including the Quadripartite organizations, the UN Food and Agriculture Organization, the UN Environment Programme, and the World Organization for Animal Health. Thank you all for your commitment to this urgent global health threat, to protecting the medicines that protect us, and to ensuring all those who need them can access them. I thank you, and Peter, back to you.
Thank you very much. Tedros, and for your leadership also on this issue. It's now a pleasure to introduce a video message from Her Excellency Prime Minister of Barbados, Mia Mottley, and who is also the chair of the Global Leaders Group in this matter. Can we...
Your Excellencies, my dear brother Tedros, dear colleagues and friends, it is truly an honor to speak to you today as chair of the Global Leaders Group on AMR. This strategic roundtable is an important opportunity to discuss priorities for the high-level meeting on AMR. I thank you, Dr. Tedros, for prioritizing attention to this crisis and for WHO developing its strategic and operational priorities to tackle AMR in human health. I welcome the establishment of the WHO Task Force of AMR Survivors, as it is important to hear this voice. Many of us have likely had a course of antibiotics in the last few months for a commonplace infection or indeed for a life-saving medical procedure, maybe even after an extraction of a tooth. Too often we take for granted that these medicines will literally save our lives and stop all of the infection. The gravity of AMR hits home when trusted antibiotics stop working. The terrifying prospect of ineffective medicine is regrettably already a reality for too many. Only this week in our own circle, in our own party, in a neighboring constituency of mine, we lost a young lady within less than 48 hours. Once again, another statistic for the AMR battle that we are regrettably not winning fast enough. Data from the recent economic study commissioned by the GLG shows that without a stronger response than we are mounting today, there will be an average loss of life expectancy of almost 2 years globally by 2035. Unless we do more, my friends, AMR will cost the world an additional $855 billion annually in extra healthcare costs and lost productivity. As we all strive to do more and better in our response to AMR, it is critical, and I repeat, it is critical for governments to take a whole-of-society approach, considering its impacts, its drivers across the human, animal, agri-food, and environmental sectors. And that is what the Global Leaders Group has tried to do with the quadripartite group that we have. As chair, I am proud of our recent publication of 10 recommendations for member states' consideration to inspire an ambitious and outcome-oriented political declaration. Adequate, predictable, and sustainable financing must be available to address AMR, including financing for research and development to address the antibiotic pipeline and access crisis, and for implementation of multi-sectoral national action plans on AMR, especially in low and middle-income countries. Regrettably, the economics of antibiotics just does not work to be able to give it a dedicated pipeline of funding on its own. Accountable, effective, and functional multi-sectoral governance is also critical to coordinate a global response to AMR and to successfully implement interventions. I believe that we should establish an independent panel to monitor and report on the science and the evidence. To facilitate collaborative and coordinated action against AMR, the quadripartite Joint Secretariat on AMR must, in my view, also be formalized and must be adequately resourced. This is if we are to avoid that awful, awful thought and determination that by 2050, this could be responsible for killing more people on Earth than anything else. Of course, my friends, our policy actions should be evidence-based. If COVID taught us anything, it is that we have to strengthen human resources and surveillance to get that data on which to make decisions. And fundamentally, we must focus on prevention across all sectors: clean water, safe and effective sanitation, food security, infection prevention and control in all settings. And we must safeguard against environmental contamination by antimicrobials. To inspire action and to drive a more robust response, the Global Leadership Group proposes global targets on reducing deaths caused by bacterial AMR, promoting antibiotic stewardship and responsible use in humans, yes, teaching our people about it, and optimizing antimicrobial use in agri-food systems. We want these global targets to also inspire development of national outcome-oriented sector-specific targets to drive country-level action. But this will only make a sense to all of us and to all of our people if the public education and sensitization drive takes place right down to the individual citizens. I urge member states to consider the Global Leadership Group's inputs so that the 2024 political declaration helps us move beyond rhetoric towards a response at the scale and with the urgency AMR demands. In this fractured world, my friends, let us take some steps to safeguard people, animals, economies, and our natural world. And let me take the vagueness of what we are talking about. Let us take steps to save those in our family, in our workplaces whom we know, and at the rate at which we're going, just too many people whose names will only now become a statistic, like our own Simone this week, who we lost. I thank you for being here today, and I wish you a productive meeting. I am truly with you in spirit. Thank you.
Thank you so much, Prime Minister Mottley, for sending this video, but above all for your leadership. Without leadership at the highest level, I don't think we will be able to solve this critical issue. Now let's go to the panel. As a chair, I would like to ask all panel members to stick to the time. This is about people. It's not just about statistics. That's why I'm so grateful that we have Vanessa Carter here, who's the chair of the, the panel of, the task force of WHO on AMR survivors. Thank you so much, Vanessa.
Thank you. Thank you, Dr. Tedros, for inviting me today to share my lived experience. I do have slides. I'm not sure. There we go. Oh, can you hear me better? Thank you. This was my last photo at age 25 years old. On the right-hand side is our 3 generations. It's my mother, it's me, and my grandmother. Next slide, please. Very shortly afterwards, I was involved in a devastating car accident in Johannesburg in South Africa. I was on the side of the road. I was resuscitated because I had ruptured abdominal organs. I had a major head injury. I had many facial fractures. I lost the right eye, and I also had a neck and back injury, and taken to the high care unit and kept there for about a month until I was able to be discharged. Next slide, please. So this is a snapshot of a 9-year journey. Even though I had all those other injuries to me, the most complicated were to my face. And so I needed to have different prosthetics implanted. Next slide, please. In my 6th year of surgeries and my 4th prosthetic, I went out shopping one day. I came back to the car and I felt moisture on my face. And when I pulled down the rearview mirror, I saw this pus seeping out of the cheek prosthetic. And I called the doctor and I said, what do I do? He said, you need an emergency surgery. This is an infection. So we did the emergency surgery, which was to debride the prosthetic. But 2 weeks later, the infection came back again. So we did more surgery, but 2 weeks later, the infection came back again. I was then under the care of different types of specialists, ENT surgeon, ophthalmologist, plastic surgeon, maxillofacial surgeon, each of them prescribing antibiotics, doing surgeries, until 11 months passed that this infection had still not cleared. Next slide, please. So at that 11-month mark, they removed the prosthetic in an emergency surgery and sent it for testing. That was the first time I heard the word test, and so I phoned the pathology officers and requested a copy of that. Along the right-hand side was a group of R's and S's, and at the top read the letters MRSA. And like any other patient that wanted to know what is happening to their body, I went onto the internet and I started to try and understand what that meant. And up came antibiotic resistance. Next, as you can see on the left-hand side, that was all the damage that had been done by this flesh-eating bacteria. I could hardly keep an artificial eye in, and I had to cover my face. You know, things like I'd go fetch my child from school and the children would be quite scared of me. So next slide, please. So in desperation, because it felt like my doctors had now given up hope, we had to get the, to fix that damage, we had to do it in as few surgeries as possible. So I reached out to a craniofacial surgeon in the USA, and he gave me some advice over a video consultation, which I took back to a maxillofacial surgeon in Johannesburg. That was to cut the bone and realign it. And unfortunately, even though aesthetically it looked good, next slide, please. The infection came back again, this time even worse, all over the face, in the skin and at the bone. So my doctor then rotated antibiotics, and slowly but surely over a 4-month period, very close monitoring and working with him, the infection finally cleared. Next slide, please. So in my first slide, I said that was my last photo. I avoided cameras for obviously that whole 10 years. It was very difficult to look at my face in the mirror watching this infection eating the skin away. This was some of my first photos after that 10-year period where I felt confident enough to show my face to public, Next slide, please. So the work that we have gone on now to do, I've been an advocate for the last 11 years, and most recently we've established the WHO Task Force of AMR Survivors. I've just shared my story with my one face, but this is about the many different faces of AMR. We're made up of 12 members with different unique stories. Next slide, please. And one of our biggest objectives, or some of our biggest objective, is to obviously bring the human impact, to move beyond the science and the numbers, and for several reasons. Because when policy makers understand exactly what that is, and members of the public understand exactly what that is, we can break down. We can empower them. One of the documents that we've just worked on, and I'll end now as well, is a strategic technical guidance document for meaningful patient involvement. So I would encourage you to go take a look at that on the WHO Task Force of AMR Survivors website page as well. So thank you.
Thank you so much, Minister, for your moving testimony, but this is what it's all about, and that's why we need to take action that, others will not have to go through what you had to go through. Now we're going to Professor Ramanan Laxminarayan, who has been working on this issue for many years. He's the president of One Health Trust and also the chair of the Global Antibiotic R&D program. But also this week, a special issue of The Lancet on sustainable access to effective antibiotics was launched by him. So over to you, Ramanan.
Thank you, Peter. Thank you, Dr. Tedros, for the invitation to speak. Excellencies, friends. All of you have heard about AMR. Sometimes it's a bit obscure, but the real issue is of sustainable access to effective antibiotics. That's really what the problem is about. Because we have to remember that lack of sustainable access to effective antibiotics kills more people than AMR does, right? So the Lancet series, I've left some infographics at the back there for you to pick up on your way out. But I want to remind you that the problem of this access is seen as neither urgent and it's seen as too difficult, and neither is really true. It is urgent because it kills more people than HIV, AIDS, and TB put together, and malaria put together. It's absolutely addressable using tools that we already have: water, sanitation, hygiene, IPC, immunization, and better access to existing antibiotics. So this is a problem that can actually be solved. Since the high-level meeting in 2016 in New York, we've made progress on many fronts. I think the setting up of the AMR division here at WHO under Dr. Tedros' leadership has facilitated progress on many fronts: guideline setting, surveillance, national action plans. But critically, it has facilitated intersectoral coordination with other UN agencies, FAO, WOA, and UNEP. And in effect, this work on AMR has set the stage for One Health, which is a complex word in some ways, but it's a very simple and ancient recognition that our health is inextricably intertwined with the health of animals, the planet, and the plants. That's all it really is. Now, the 2016 UNGA Declaration objectives, where we have performed, including on setting up the IACG and creating national action plans, were very specific. In other words, where we were specific, we have succeeded. Where we have been vague, we have failed. That's really the lesson, not just from the 2016 UNGA meeting, but also from the Millennium Development Goals, from the Montreal Protocol, from indeed any international agreement where we've been successful, all of which have 4 elements. They have political will, they have specific measurable targets, they have funding, and they have governance and accountability. Now, we clearly have political will, otherwise all of you would not be in this room. Now, we need to hold the world to measurable targets and then find the funding to reach them. Now, the Lancet series, which was kick-started at the African Union, launched earlier this week in Geneva, and represents the best science and expertise in the world, calls for 10, 20, 30 targets. Basically, it's a 10% reduction in mortality in humans, same as what the GLG has called for, a 20% reduction in inappropriate antibiotic use, but against a backdrop of universal access to WHO's access antibiotics, and a 30% reduction in antibiotic use, inappropriate use in animals, which is again very achievable because WOA has reported that there's already a 17% decrease in the last 6 years, so another 13% is not really that hard. So these targets are achievable using currently available tools, many of which are already funded. They're supported by science and evidence. They hold us collectively responsible for progress before 2030, when the SDGs are also due. The Lancet series, as you heard from Prime Minister Mottley, also calls for the establishment of an independent panel for evidence on antibiotic resistance and access. Access is very important to ensure that the best science and policies from around the world are shared. Now, friends, each year, 7.7 million people die because of bacterial infections. 7.7 million. Only a subset of those are AMR. Many of these infections can be prevented. Many can be treated with cheap antibiotics that have been available for a long time, but are still not reaching patients in need in many LMICs. And many of these patients will also need new antibiotics, which have to be developed, incentivized, but even those may never reach patients in need unless we plan for this to happen. The Lancet series calls for existing global fund agencies that are already in this city to create an antibiotic access fund that can ensure that existing and new drugs are available and that they're available to patients in need in LMICs. All of this will cost much less than what we spend on other disease conditions with much lower disease burden. The UNGA high-level meeting in September gives us a great opportunity to act. The targets, the call for funding, independent panel are all already in the zero draft, this excellent zero draft that Barbados and Malta have produced. We can build on this to make sure that we produce an actionable document that can produce results within the next 3 years. I think of AMR as an optional crisis. Unlike with other pandemics where we're at the mercy of other events that are outside of our control, dealing with this one is entirely in our hands. We can and should ensure that no one anywhere suffers or dies because of lack of access to effective antibiotics. Thank you.
Now thank you so much, Ramanan, and with some concrete proposals now, great pleasure to introduce Professor Dame Sally Davis, friend, and you've been really one of the most important global voices on this. Over to you, Special Envoy on AMR for UK.
Thank you very much, and I want to start by thanking you, Director General, for setting this up. Always important, but particularly in this year with the high-level meeting. And Vanessa, I've heard you speak before. You are always very moving, and you bring the reality into the room, and I admire how you manage to do that. Thank you. Let me bring into the room the 1.3 million people who die every year of AMR, the 5 million who die where AMR is in their bodies and it contributes to it. Let me remind you that children, particularly under 5, are particularly vulnerable, as are the elderly. Just think about the demographics in many of our countries and how more and more people are going to be more vulnerable to this. So let me too congratulate Prime Minister Mottley for her leadership, and actually Barbados and Malta for their political leadership in co-facilitating this quite complex process. They've produced a zero draft that really gives us strong foundations for negotiations. We all want this high-level meeting to be action-focused and outcome-focused and give a roadmap for the way ahead. But as we move forward, we're going to need implementation discussions, so I welcome the Kingdom of Saudi Arabia fourth ministerial meeting aimed at just this in November. I think it's great to see that we've got several core priorities that many have called for in that zero draft. Prevention, many of these Ramanan has picked up, access, but also governance, accountability, and One Health in this draft. It is not the One Health, as some people say. It is a One Health because we all have different One Healths around the place. And also, for the first time, a commitment to establish a global independent science panel. The UK position is we ensure that the high-level meeting, which is on AMR, so that has to be the focus, truly addresses the needs of the most vulnerable communities, offering clear support to low and middle-income countries, who, after all, carry the greatest burden of this antibiotic emergency. So we've consistently called for fair and equitable access to antibiotics and diagnostics to be a high priority. Better access to essential antibiotics combined with an improved pipeline of new antibiotics and diagnostics will save millions of lives to come. And it needs to be embedded in a better system of WASH, IPC, vaccines and prevention with responsible stewardship. We from the UK are also calling for existing international financial instruments to be made available to support AMR interventions. There is money available, but most countries don't know what's available and find it too difficult. Our financial institutions, led by the World Bank, who've just published an excellent AMR framework, need to make it more evident and more easy to get that money. We convened a meeting recently in London on the 16th of May with global leaders from all sectors and many countries, and we from the UK have pledged support with funding for these priority areas. And this includes the panel, which is going to need to be truly independent, multi-sectoral, strong representation, and I hope strong leadership from the Global South. We've got to support each other as states and as groupings, sharing updates, evidence and best practice. And actually, we believe there is a strong need and desire for a voluntary monitoring and reporting framework. And we've got to back up the actions that member states commit to. We also want to strengthen the quadripartite structure, perhaps a rotating chair, but formalise it. But the reality is the best drafts are only drafts, and it is the collective responsibility of all of us to ensure key commitments to prevention, access, a panel, strengthened accountability, coordination, governance, access to finance. All of those things we know are going to be important for saving lives going forward, are preserved and strengthened as we go through these negotiations. If we do that, we can get a clear pathway from declaration to implementation in November. So we're going to be working with the co-facilitators, the international community and partner countries to really look closely at the declaration and ensure, as far as we can, that it steps up to these, our shared ambitions. So I'm going to conclude. No surprises here. I'm calling on everyone to make equity, One Health and action the cornerstones of our next steps to tackle AMR. And I'm looking forward to working with all of you over the next few months. Thank you very much.
Thank you very much, Sally, for not only being a great champion, but also have been very action and implementation oriented. May I now ask His Excellency Dr. John Kaseya, the Director General of the Africa Centers for Disease Control and Prevention. Thank you very much, my friend.
Thank you, Peter. Please let us be led by data. Based on Lancet that was released in 2022, over 1 million deaths in Africa were associated to AMR and 250,000 directly linked to AMR. That is almost 20% of the statistics that Dr. Tedros was sharing with us. But please let me be clear on that. Because we know, based on the studies that Africa CDC released on 2023, that only 1.3% of our labs in Africa are able to perform bacterial resistance testing. It means this data that I'm sharing with you is an underrepresentation of the reality in Africa. In 2020, the AU African Union Assembly decided to establish the AU-wide task force to control AMR. And it was a recommendation for all member states to put in place a strong national action plan to respond to that. But let me share with you, today we have less than 10% of our member states that have national action plan that is fully funded and implemented. We know that people in Africa are mostly dying, as Ramanan said, due to lack of antibiotics. But when we want to talk about AMR, it's mostly driven by fake medicines. I was talking with the minister of DRC, was telling me 80% of antibiotics in DRC are fake. It's also led by the irrational use of antibiotics, poor food security and water sanitation hygiene conditions. We applaud the initiative of the high-level meeting in September in New York. Africa CDC, we will do our best to bring a number of our head of state to attend because we need a strong political commitment. This strong political commitment will unlock not only the National Action Plan, but also appropriate domestic resources to start to target this AMR. We agree, as Ramanan said, on the target of 10, 20, and 30, because that one will be our motto and our objective for the next 5 and 10 years. Today, in Africa, we consider that AMR becomes a major vehicle for the universal health coverage because it's targeting all pillars of the health systems in Africa, including sustainable financing. Let us talk about financing. Yesterday, I had a meeting with a number of partners, and I'm calling for the extension of the mandate of Global Fund, because Global Fund, they are using TB to target AMR. I'm calling today, officially, to expand the mandate of Global Fund to become Global Fund against HIV, TB, malaria, and AMR. And Africa CDC will work together with all partners, and I thank Sally for the initiative that you took, with all partners to provide appropriate funding to tackle AMR with this initiative we are calling today. We'll work to reinforce availability of quality data, because that one will help us to lead for appropriate decision by reinforcing the surveillance and the lab systems. We'll also reinforce the community engagement, because we need people to have appropriate information and to stop the irrational use of antibiotics. Lastly, we are calling to accelerate the agenda of local manufacturing in Africa, because we want all Africans to have access to quality and affordable antibiotics when they need it. Thank you.
Thank you very much, Jean, for highlighting a number of issues and, again, some very practical proposals and also highlighting the manufacturing. Now, our next speaker, it's my pleasure to ask Dr. Abdullah Al-Ghizani, who is the CEO of the Public Health Authority of the Kingdom of Saudi Arabia. Thank you for being with us and for hosting the next ministerial meeting. Thank you.
Thank you very much, Peter. Dear Director General, honorable guests and delegates, it's a great pleasure to be here today. And I would like to thank you for inviting me in this round. And Vanessa, thank you very much for sharing your story and your bravery in this, with your story. I would like to emphasize the concept of the health and all policy that we are embracing in the Kingdom of Saudi Arabia. And we have made health a part of, a significant part of the Vision 2030. Under leadership of the custodian of two holy mosques, King Salman, and His Royal Highness, Prince Mohammed bin Salman, Crown Prince and Prime Minister. In Saudi Arabia, we have implemented an effective cross-sectoral governance for a framework for AMR. There is an urgent need to have more accountable, effective, and functional multi-sectoral governance system in place to coordinate the local, regional, and global response to AMR, and also successfully implementing targeted interventions. We are working with the global leader group and the quadripartite, and with a number of member states who share our sense of urgency in uniting around a set of urgent practical measures to tackle growing threat of AMR. In this critical year, we need to stay focused. We need convergence around limited number of action which can be approved at high-level meeting. It is in our intention to take the declaration from New York in September, and in the consultation with the quadripartite and other countries, turning into a very concrete action in Jeddah in the 4th AMR ministerial meeting, under title From Declaration to Implementation. Please let me reinforce the ambition of the Kingdom of Saudi Arabia to make the 4th Ministerial Summit an inclusive forum to which all of you can contribute. In this context, we will be announcing a series of innovative and practical outcomes, aligning with the Saudi Vision 2030, which will support countries and partners in implementing their cross-sectoral AMR National Action Plan. Also promoting stewardship, building capacities, and support effort to improve access of antimicrobial in the region and beyond. Thank you.
Thank you very much, Abdullah. I really like your, your soundbites, from declaration to implementation. This is what we are in that phase now. Now we're moving to Korea with Dr. Young-Mi Ji, who's the Commissioner of the Korea Disease Control and Prevention Agency. To you, please.
Thank you, Mr. Chair, and also thank you, Dr. Tedros, for organizing this very timely event on AMR. So today I'm going to briefly share with you what we have learned from the implementation of National Action Plan on AMR in the past decade, and what we can do together to overcome AMR in partnership with WHO and other partners in coming decades. So in line with the WHO's global strategy, Korea has taken initiative to develop and implement first and second AMR National Action Plan based on One Health approach involving 7 ministries and agencies, and also initiated multi-ministerial research and development with One Health AMR concept. And while we are implementing the first National Action Plan, we were able to advance the AML surveillance in the human sector as an active partner of WHO GLAS, and we were able to use this data into our AML control policies. And also in non-human sector, we integrated requirement for antimicrobials and strengthened AML testing across non-human sectors. And we have secured AML-related legal background, budget, and dedicated team to ensure the timely formulation of national policies on AML and sustainable operations. And very importantly, we have introduced incentives for IPCs in hospitals. With the second National Action Plan on AML, we focus on IPC, and we further improved our AML surveillance with One Health perspective. So for example, we have conducted a pilot One Health surveillance where many ministries are participating, and also we have built joint AML surveillance data portal, and we will be expanding the One Health surveillance, which we have done with as a pilot to other areas nationwide. And also, very importantly, we will also introduce compensation system for the antimicrobial stewardship program in hospitals within this year. So with the implementation of our National Action Plan, antimicrobial use and AML rate has been much reduced in both human and non-human sectors. And also we have implemented National Action Plan on healthcare associated infection from 2018. We have strengthened national surveillance for healthcare associated infection and expanded the IPC surveys in hospitals. So now moving on to our international cooperation efforts, my agency hosts the WHO Collaborating Center for AML Reference and One Health Research since 2021. And with our ODA project, we provided support to strengthen AML lab capacity in resource-limited countries. We will, of course, further expand our role as a WHO Collaborating Center to support WHO's Global Action Plan on AML. In addition, the COICA is International Cooperation Agency in Korea. They had a project on AML providing approximately $9.75 million to 4 countries, Jordan, Peru, Laos, and Mali, from 2017 to 2020 through WHO headquarters. And this grant supported capacity building in 4 countries to join WHO GLAS, and they were able to establish the National Reference Lab linked to WHO GLAS. And this really represents international collaborative project with the multidisciplinary stakeholders. They all made concerted efforts to address AML challenges in those countries with more vulnerable situation. And this achievement has been featured in the 2022 WHO GLAS report. And during this assembly, I participated 5 events related to AML, including 2 hosted by Korean government. This clearly shows now is the real moment for all of us to affirm our commitment to tackle AML. And my country will continue to work very closely with WHO and member states and partners to ensure the high-level meeting in New York will stand as a unique opportunity for all of us to accelerate One Health's multi-sectoral, global, regional, and national action to overcome AML threats. And before I conclude, I'd like to propose one thing to WHO. I think WHO regional offices and country offices should strengthen AML work, possibly to the level of EPI, Expanded Program on Immunization. I really felt that during the EPI 50 years celebration 2 days ago, 3 days ago. And if we really want to succeed with AMR, we definitely need more investment in AMR program in all levels of WHO. I very much look forward to seeing more commitment from partners and member states and more support from WHO regional office and country office for resource-limited countries. Thank you.
Thank you very much to Chi Young-mi for highlighting concrete national action and also the international role that you're playing. And then finally on this panel, before we move to the room, we have the pleasure of having the chair of the quadripartite working group on youth engagement on AMR, Audrey Wong. Over to you, Audrey.
Dr. Tedros, honorable guests and delegates, it is great to have this opportunity to speak on behalf of our working group. We are a group of 14 dedicated young leaders who are passionate about advocating for AMR. And AMR is an issue that is close to my heart. As a young pharmacist, this transition from the student to pharmacist is not easy when I see more real-life AMR cases, and it's even more devastating when I see young patients developing multi-drug resistance and have to discuss with them a few options they have left. The urgency to act is commanding, so young people have been using our creativity in different initiatives, such as the Global AMR Youth Summit, as well as the malaria storybook that actually our working group created. I'm also very happy to say that our working group just launched our youth manifesto about 2 weeks ago, right before the multi-stakeholder hearing on AMR, which we co-created with over 90 young leaders around the world. And in this youth manifesto, we identified 4 different key priorities. The first one, advocacy and engagement. We continuously create for the platforms to learn, to collaborate, and to act. And with different community engagements that we have, we are also ready to contribute to the national action plans. Second, education and capacity building. We might think that a lot of people already know about AMR, but in fact, actually a lot also don't. So we see the gap in continuous education in AMR awareness and to strengthen the curricula at all levels of education. Third, patient care. As a lot have mentioned, the importance of having equitable access to effective, high-quality diagnosis and treatment, but we also see the need for the workforce that is driving behind. For young health professionals, we might go into the field and ask, how will my future look like? And is it worthy to invest when we see a lot of failures with AMR? So there is a need to foster this research and development ecosystem to attract and also retain emerging and existing talent in the discovery and development of antimicrobials. Last one is to address AMR for a One Health approach. While the concept of One Health is familiar to a lot of us here, we see that there's a pressing need for enhanced interdisciplinary collaboration among sectors. The future we seek to protect is rapidly approaching. A good thing is that tomorrow's leaders are here today. Shout out to all the youth in this room. Now is the time to join the youth movement, act today for a healthier tomorrow against AMR to achieve health for all and all for health. Thank you.
Thank you, Audrey. It's clear that if we can't control this problem, that there will be not much future for youth, and just like for climate change. Let's now move to the floor, and may I invite to Marijke Wijnroks from the Global Fund to the floor. I think, Marijke, you're sitting there.
And the Global Fund was already mentioned in a few interventions, and thank you for your confidence in us. Well, first of all, as an organization whose core mission it is to fight HIV, TB, and malaria, thinking and being concerned about drug resistance developing is really key, and we've been concerned about that from the moment we started our work. and have spent a lot of efforts in prevention and monitoring, but also responding to drug resistance as it's developed. So we do have that experience. We also know that people living with HIV or TB are at high risk of bacterial infections and thus of AMR. So we need to think about how AMR affects our mission. And already we are procuring antibiotics as part of our pooled procurement mechanisms. In addition to our specific, the fight against the diseases, we are spending at the moment, we're making the highest investment ever in health systems strengthening and pandemic preparedness and response. This includes activities such as infection prevention and control that are critical for the prevention of AMR, but also investments in lab system strengthening, integrated disease surveillance, and in the health workforce with a strong emphasis on community health workers that are critical elements of the health sector response against AMR. In addition, I think people are looking at the Global Fund because of our comparative advantage in market shaping and accelerating access to key commodities that are relevant in low and middle income countries. And working with partners over the last 20 years, we really have created a healthy market for commodities in the HIV, TB and malaria space that drives innovations, but also results in commodities that are accessible and affordable to people. We're really pleased that the focus in the AMR agenda is shifting towards sustainable access because, as previous speakers have mentioned, for many people in low and middle income countries, their key concern is lack of access to even the most basic antibiotics. So we are happy to engage in further discussions on how our experience and expertise in market shaping can support the AMR agenda. Thank you.
Thank you very much, Marijke, because you'll be essential for delivering. And also you've been dealing with a very important element, and that is multi-drug resistant TB, and which is not enough highlighted, I think, in this discussion. Now, very good pleasure to ask Dr. Jon Arne Ruttingen, who is the Chief Executive Officer of the Wellcome, for sharing your experience. Thank you.
Dr. Tedros, Excellencies, delegates, it's an honor for Wellcome Trust to address you here today. We are a foundation supporting science with the aim to improve life and health for everyone, everywhere. We have focused on research on antimicrobial resistance for many years. We have focused on the need to address the pipeline of new antibiotics. But more recently, we really see that to do that, we need first political understanding. Because this needs to be higher on the political agenda. We have just heard from the Global Fund, the 3 diseases, really key and great progress internationally. But today, more people die from bacterial infections than TB, AIDS, and malaria combined. And the disease burden is also bigger for the 7 most prevalent bacterial infections. So it is a key for us to address this. So that's why we need to have that on the political agenda. We need to translate understanding to political will. But then we believe we need 3 asks for the high-level meeting and the conclusions. And all are related to accountability. The first is about having goals and targets already addressed by the panel. The most likely way, because we know it will be difficult to negotiate in New York, but at least to maintain the objective of a target talking about saving lives, talking about reducing morbidity is really key. And we believe that is first and foremost a global target. In addition, countries need to commit to national targets when it comes to consumption of antibiotics. Second, those targets and all what we do in this space needs to be rooted in better evidence. So that's why it's also great to see that the panel, the zero draft, also mentioned by the panel, is suggesting a scientific evidence panel that can provide this independent advice, can hold countries accountable, can hold the 4 organizations constituted through the quadripartite accountable, and make sure that we have a solid evidence base in the years to come. We are so pleased to see that the UK, the Kingdom of Saudi Arabia, and also the European Commission have already indicated the willingness to financially support such a panel. It's then key for member states in New York to agree on how it could be constituted. But finally, for accountability, we need to follow-up. We cannot wait for 5 more years after that high-level meeting to come back. We actually need a mechanism for countries to come together across the 4 sectors to actually demonstrate that, yes, we are progressing towards the targets, yes, we are following the evidence base, and we are accountable together. Thank you.
Thank you. Thank you very much, Jon Arne, and very much to the point. And my final invitation for the floor is for Ambassador Magnus Lennartsson, who is the new Swedish Ambassador for Global Health. There it is. Thank you, Magnus.
Sweden's gratitude for the convening of this strategic roundtable, AMR, and the lack of access to effective antibiotics constitute truly an urgent and growing global health threat. We need a people-centered, we need a whole-of-society approach, and we need countries to move from plan to action. We have high expectations on the high-level meeting in September, leading the way to more effective action at the country level. We welcome the language on this in the draft political declaration, but to get there, we need effective governance, we need better coordination, and we need stronger accountability. And we need to mobilize more financial resources. Let me say also that we are encouraged by the strong support for the establishment of an independent evidence panel in support of data, science, and implementation of national action plans. Colleagues, we are at an all-hands-on-deck moment. Let us join hands to make September meeting an important turning point in our common fight against AMR with strong political commitments and a clear focus on implementation. Millions of lives are at stake. Thank you.
Thank you very much. Because of the time, I'm afraid we'll have to continue the discussion later on. And before giving the floor to Dr. Hanan Balki, let me just share a few thoughts. One, this is not only a big problem, but it's a problem with a solution, and that is really important. So we actually have plenty of tools, but they will only materialize if there is the leadership and if there is the funding, both at national and at global level and regional level, as some alerted to, and as we heard. And with the upcoming high-level events, be it in the Kingdom of Saudi Arabia or at the UN General Assembly, the soundbite from declaration to implementation is really key, with clear accountability. We've had too many resolutions that didn't have that. And that should be grounded in science, definitely. This independent panel is absolutely key, and I hope it can be established as soon as possible. We didn't talk too much about innovation, but that will also still be required. And here, it's not the innovation that is lacking, but it's the mechanisms to bring it from the basic research and to go through this valley of death that it leads to actual products that are accessible to people. And I think lessons from COVID would be useful, for example, to at some international meeting to reach an agreement on harmonization and regulatory requirements for new products and for their access. We will need to also, I think we need to do something about the narrative. Personally, I never use the word AMR because I don't know anybody outside this room or a few others who ever have a clue what that means. And so we need to have the narrative, and that's why the voices of people who went through this is so important, and that we are also making sure that this doesn't lead to, as I hear sometimes, to say that all antibiotics are bad, because then we're going to kill also lots of people. So that narrative is important. And finally, let's make sure that Louis Pasteur was wrong. When he addressed the Academy of Science, and he said messieurs, because there were no women then in these days, les bactéries, les microbes auront le dernier mot. The will always have the last word. Let's make sure that that's not true. So let me now ask good colleague and our leader of the AMR work when she was the Assistant Director General for AMR, and now the Regional Director for EMRO. Anand, you'll speak from there, yes, please.
Thank you, Professor Piot. Your Excellencies, ladies and gentlemen, dear Dr. Tedros, it's a pleasure for me to give the closing remarks. However, you made it a bit easy, but you also made it a bit difficult. The topic is extremely complex, and I like to address it as the phenomena of antimicrobial resistance. But as you said, Peter, for the normal people who are not in this room, it's the bugs that do not listen to antibiotics, that do not respond. That's the simplest way of putting it. I think in giving some closing remarks and maybe leaning a little bit more on my new role as the Regional Director of the Eastern Mediterranean region since February 1st, I think that we have a major role, as Dr. G said, the regional directors and at the country offices, what are we going to do differently? And because it's a phenomena, and because it's not a disease that's going to be eradicated, unfortunately, we have a huge role in bringing all the partners in, from the patient awareness, and Vanessa, you've done a phenomenal job, and you're always, she's part of our STAG, by the way. When I was STAG, now she's with Yukiko. But we need more people to talk about their challenges with antimicrobial resistance and how they suffered in the hospital and how they did not even understand what the problem was. And it took you some time to realize that. I can assure you that at the regional level, my colleague regional directors and I, we have spoken about this, and we have been moving forward with collaborating and understanding how to better implement national action plans. The beauty of my past 5 years here in Geneva is that at this point I'm also seeing the evolution of progress on AMR. So I do have hope. There has been a lot of milestones that we achieved. Yesterday's resolution on the human health strategy is a huge milestone that we will take it into action at the country level. We will be working at the regional levels to understand how can we better improve resilience from the region to the region by improving the national regulatory authorities that can help work on substandard and falsified medications, which you talked about, medications that are not qualified to be given to humans. We're going to work better on enhancing pharmaceutical agencies to produce antibiotics within the region, to the region, so that we do not have lack of access of antibiotics. We're going to work much stronger on identifying innovative ways, specifically for the Eastern Mediterranean region, that many of the countries are suffering from sanctions, geopolitical wars, displacements, and living in uninhabitable conditions with very challenging situations of drinking unclean water and living in unhygienic environments and moving from one place to another. These are real challenges that in order to address antimicrobial resistance, it has to come within the context of addressing, number one, humanity, dignity, and at the core of that comes identifying and addressing the issues of health. So I think I also want to acknowledge the amazing work that is done by the partners, whether it's Wellcome Trust, Global Fund, FIND, Gavi. Immunizations are extremely important, and I think the prevention that immunizations can do in preventing infections are very important in increasing the demand of use. But there's also one thing that I hope that we can do a bit more better, is linking health and antimicrobial resistance to the economy and trying to find innovative ways to solve that problem. Antibiotics are important for the economies of countries because it has to go into the use of antibiotics in agriculture. So in the innovative antibiotic research and development, it would be great that we find solutions for preventing infections in the animal sector that are not used in the human sector. And that's a very specific demand that we need, because otherwise we're going to continue to compete between antibiotic used in human and animal sector. We have a great collaboration among the quadripartite. I witnessed it, I can attest to that, and I hope it flourishes and continues. And I think just in my last statement, but I just want to refer to it so I don't repeat, the high-level meeting is going to be very critical that you all engage, your missions in New York engage, and that you take a critical look at the resolution. You understand that it serves your purpose at the country level, and that we move forward from resolution to implementation, hopefully in the 4th Ministerial Conference. First two ones were done in Europe. The third and the fourth were done in my region, Eastern Mediterranean region. I call out for the other regions to host it in 2026. And I really hope that in the build-up to the high-level meeting, we will continue to brainstorm, talk about this important phenomena of antimicrobial resistance. Thank you very much, and back to you, Peter.
Thank you. Thank you so much, Dr. Anna Balki, for your passionate and evidence-informed leadership. Thank you. The session is over. Thank you.